just before New Year's Eve, the U.S. Preventive Services Task Force, that's a big mouthful, I always forget what all it stands for, but it's the organization designated by the government to look at studies that are done and make recommendations to what doctors should offer the patients. So it's a very powerful committee, and it does it in many areas, in cardiac, in all sorts of prostate, in cancers, and in diseases other than cancer. And they decided to recommend that screening should be provided. So that is a tremendous step. As you heard from the TV series, people have been waiting for a long time to have that. So I think that was a signal event. As now things go more slowly. Now during the next year, Medicare and Medicaid will be looking at their recommendations, and hopefully by January of next year, we'll have this service covered so that you can go and ask for a screening. So that's really phenomenal. And to do that, it takes a whole team. Thank you for mentioning me, but it really took a whole team from the beginning. It took all the disciplines: surgery, pulmonology, oncology, radiation therapy, pathology. And that part I understood from medical school, but what really did it was the patients. When we published that article, the people came and said, I want to have this done, and I'm going to Washington if I can't have that done today. And the media. The media is what made the patients aware of it. So it's the media and the patients and advocacy groups. You'll hear Sheila Ross talk. They've been working tirelessly behind the scenes to make it get to this point. The science alone would not have driven it. And the reason breast cancer does so well, it's the women get out there and really fight for it. So we as a group, as lung cancer survivors, as people who have family at risk of lung cancer, we really have to fight for this. And just to tell you a little bit of the struggle, as you've heard, when we started our thinking about screening, the CAT scans had just come out that allowed you to get the entire chest in a single breath. Think of it as taking a piece of bread and slicing it slice by slice and looking at 30 images. That's all we saw at the beginning, 30 images. Now we see 800 images. We don't see little tiny images like that. We see them on a huge monitor. So we see much more. We have to learn how to use that information. We learned that we can see emphysema, we can see coronary heart disease, we can look at breast density. That's what we're exploring now. And you have an increased risk of breast cancer if you have increased breast density. So there are many things that we have to keep on learning how to provide better care. But initially, as I said, we had these little tiny images that we saw, and the team decided how to manage them, and we've continued to improve that all along. When when we published the study in the New England Journal, people said, well, that should be enough. And yet it took another, 15 years to get to this point. So it's amazing how long it takes to really make progress and make that available to people. And hopefully we'll learn from this lesson and we'll be able to do this in a faster way than we are currently doing. And at the moment, it's said that we should screen people 55 to 80, according to the U.S. Preventive Services Task Force, who have smoked at least 30 pack years, that's a pretty heavy smoking history, and who have quit within the last 15 years. But we really think it should be broader than that. Because after all, if I quit 15 years ago and was in that age category, I still am at high risk of lung cancer. And so and people who are younger, and people who have other risk factors, secondhand smoke, asbestos exposure, really should have a discussion with their physician or reach out to a lung cancer advocacy group and find out information and have a discussion of whether they should be screened or not. The CT is less than, it gives a radiation dose that's less than that of a mammogram, and it keeps getting better and better. So that whole area of shared decision-making between the patient and the doctor is an area that really needs to be developed, and we need to keep accumulating the evidence as we go along. So I'd like to stop with that and say that you really reach out to your physicians, spend some time. Maybe over time we'll be able to have more resources on web-based, in kind of a discussion. But at the moment you need to talk to your doctor about it.